Welcome. Today, we're diving into the world of urinary health to explore a common condition called nongonococcal urethritis, or NGU. We'll unravel what it is, what causes it, how it affects the body, and what you can do about it. Nongonococcal urethritis, as the name suggests, is an inflammation of the urethra, the tube that carries urine from the bladder to the outside of the body that isn't caused by gonorrhea. So, what does cause it? The most frequent culprit is Chlamydia trachomatis, but other bacteria like Mycoplasma genitalium, Uroplasma urolithicum, and even certain viruses can also be responsible. In many cases, despite testing, the exact cause remains unidentified, referred to as idiopathic NGU. Let's peek inside to understand what's happening. These infectious agents like chlamydia invade the cells lining the urethra. This triggers an inflammatory response. The body's immune system rushes to the scene, causing swelling, redness, and the production of pus. This inflammation irritates the urethral lining, leading to the uncomfortable symptoms associated with NGU. NGU is a fairly common sexually transmitted infection, particularly among young, sexually active adults. It's more prevalent than gonorrhea, hence the term nongonococcal. Accurate global statistics are difficult to obtain due to varying testing practices and reporting methods, but NGU remains a significant public health concern worldwide. Now, how does NGU manifest itself? In men, common symptoms include pain or burning during urination, a discharge from the penis which may be clear, white, or yellowish, and itching or irritation at the tip of the penis. Some men may experience mild or even no symptoms at all. In women, symptoms can be even less obvious. They may include painful urination, increased vaginal discharge, abdominal pain, or bleeding between periods. Because the symptoms can be subtle, many women may not realize they have an infection. Diagnosing NGU typically involves a physical examination and laboratory tests. A urine sample is usually collected to look for white blood cells, indicating inflammation. Swabs of the urethra sieve in men or cervix in women are taken to test for chlamydia, mycoplasma, and other potential infectious agents. If these tests are negative but symptoms persist, the diagnosis of NGU is often made based on the presence of urethral inflammation. While NGU doesn't have official subtypes, it's helpful to think of it as chlamydia-related NGU and non-chlamydia NGU. This distinction is important because treatment strategies may differ depending on the underlying cause. Treatment for NGU typically involves a course of antibiotics. Azithromycin or doxycycline are commonly prescribed for chlamydia. If Mycoplasma genitalium is identified, different antibiotics may be required due to increasing antibiotic resistance. It's crucial to complete the entire course of antibiotics as prescribed, even if symptoms improve. Sexual partners should also be treated to prevent reinfection. During treatment, it's essential to abstain from sexual activity until both you and your partners have completed treatment and are symptom-free. Prevention is key when it comes to NGU. The most effective strategies include practicing safe sex, such as using condoms consistently and correctly, limiting the number of sexual partners, and undergoing regular STI screening, especially if you are sexually active. Open communication with your partners about sexual health is also vital. With appropriate treatment, the prognosis for NGU is generally excellent. Antibiotics are highly effective in eradicating the infection and resolving symptoms. However, untreated NGU can lead to complications, especially in women, such as pelvic inflammatory disease (PID), which can cause infertility. Recent research focuses on developing more effective antibiotics to combat antibiotic resistance in organisms like Mycoplasma genitalium. Researchers are also working on improved diagnostic tests for NGU to allow for more targeted and effective treatment.